Dr. Jody Duff, and I've been a veterinarian for about 11 years. I was born and raised in Ohio, and that's where I went to vet school. But I've always loved Colorado, and so I've lived here a little over a year now. And yeah, I used to do a lot of rescue work, especially before I had my kids. So very grateful that ABRT not only does training for the community, but also is very involved in rescue. That's super important. So is
there anything you want to start with in particular?
Yeah, I mean, we can just go in the order, of the questions, but I think the biggest thing to always highlight whenever you're talking about living creatures and first aid is just common sense, right? It can be, we all have different personalities, and some of us respond to emergencies, or not even emergencies, but things that happen, unexpected things. And I think it's really important to take a deep breath, assess the situation, and go from there, because if we become hysterical or really upset, it's hard for our clear mind to be thinking, because that part of our brain that's just being reactive is going, and that is not helpful to your pet.
All right, so our first question is about a doggy first aid kit. I'm assuming, everyone who has a dog should have one, especially if you take your dog for a hike or car ride or whatever. So what should people include in their doggy first aid kit?
So I feel like this was a really good question, because of course, I kind of have this, but I just assume other people do, and they don't. So what I tried to put in this doggy first aid kit is most things that are non-prescription, but then there's also something in there that is prescription that, depending on the relationship you have with your regular vet, which is important to have a relationship with your regular vet for this very reason, you can talk to them. So, and of course, this depends on where you're going, right? This is not an exact list for if you're backcountry hiking with your dog for 3 weeks. This is more of oh, I'm going on a day hike or just one overnight thing. So water, not only for drinking, so clean drinking water, but also for flushing things. So just have a good water bottle, and make sure when you go, you have enough water for you and your pet. Tweezers, those can be invaluable for getting out thorns or cactus tines or things, splinters, things like that. I don't know if everybody knows what vet wrap is, but it's kind of gauzy type material, but that sticks to itself and can do compression if you want. You can get that from your veterinarian, but you can also get it over the counter. So Walmart or Walgreens or whatever, in their aisle for bandaging, they have stuff like that. You can order it on Amazon like you can everything else. Some gauze, a Telfa pad, which is just the brand name of a non-stick pad. Again, this would be if your pet got a laceration or a wound and you're on the trail. This is going to help, keep bleeding down, because you're going to be able to compress it. You put your non-adhesive wrap on it and then wrap it with the vet wrap. And also it's going to prevent it from getting a bunch of debris in it, right? Dirt and stuff like that while you get down the trail. Benadryl is something everybody should have in their doggy medicine cabinet. Just the over-the-counter Benadryl. Diphenhydramine is the generic, but it comes in 25 milligram capsules or tablets. If you have a tiny, tiny dog, it also comes in a liquid form. But the general dose is 1 milligram per pound. So that's pretty easy dosing to remember. So a 25-pound dog is going to get a 25 milligram tablet or capsule. And that's really good to have if suddenly you're, outside or even at a park and your dog's face starts to swell up. It's never going to hurt to give Benadryl. Now, is it most likely an allergic reaction if you're at a park? Yes, because, there's probably bugs, especially if it's in the summer, bees, wasps, whatever. Right. But sometimes dogs can have allergic reactions for no reason at all, which sounds a little scary, but it happens. Or there was a reason we just didn't observe one. Right. So having Benadryl at home or with you on a trip is always a super good idea. Just a keynote, no matter how big your dog is, you never give more than 75 milligrams at a time. So you can have a 150-pound Mastiff, but you only give 75 mg. Polysporin, which is kind of like Neosporin, it just has one less antibiotic in it, but just a good overall antimicrobial ointment. These are all things that honestly you could benefit from when you're on a hike too. It's a joint doggy person medicine cabinet. Hydrocortisone cream, eye flush. So basically just if you just have like simple saline eye wash, or like you just get some kind of basic eye flush drops, over the counter. That way, if you're walking and you're like, oh my God, my dog's like squinting. And sometimes out here, especially in the really dry summer, a gust of wind will come through. And I'm telling you, it feels like you have straight up grit in your eyeballs. And a lot of times we're wearing sunglasses and our dogs aren't, and they're closer to the ground.
Right.
So that way you can prevent your dog from getting a corneal ulcer because you can just flush all that junk out.
Okay.
So other things that you can or can't take with you depending on like what you want to do is, for instance, if you're going on a trip with your dog, you might want to take a cone just in case they get a laceration or something and you don't want them to lick it, and a towel or blanket. So towel can be useful for, if they're wet and it gets cold and you need to dry them off. It can also be helpful for stabilization and using as like a gurney. So if you have a really big dog, you probably want to have a blanket with you so that you and another person, if your dog for some reason becomes lame and is not able to walk, you can actually make like a gurney for them and carry them on it. Again, this is all like, we hope none of this ever happens, but those are things that I would put. The last thing is carprofen, which the name brand is Rimadyl. This is essentially doggy ibuprofen. You should never, 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 never give your pet ibuprofen or Tylenol. They are toxic to pets. So this is essentially, we call it doggy ibuprofen, but it is a safe formula for use in pets. And so that is something that if you have a relationship with your regular vet, having a little bit of that on hand, especially if you're going on a trip, if your pet seems painful or lame, or maybe you have like a 9-year-old dog and usually they're fine, but y'all do 6 miles and your poor dog is like limping, well, then you can help them.
Okay. Cool.
So that, I know that's a lot, but that was my first aid kit.
Okay, so question number 2 is, what are the most common injuries or medical issues that pet dogs experience, and how to best handle those situations?
Yeah, so another great question. I'd say ingestion of human food, medicines, or plant material is probably one of the biggest things that we see. Okay. There's just a whole lot of curious dogs, and so, we can prevent this by keeping an eye on your pet. If you have a counter surfer or the potential for one, keep all your stuff up in cabinets. Although I have seen huskies actually open refrigerators and get into them. So you might even need a child lock on your refrigerator. Yes. Like crazy things happen. Allergic reactions to insect bites or stings. And lacerations from that lawn edging, rocks, or ice. I feel like we see a lot of lacerations here in Colorado Springs, and so much of them are due to that ridiculous metal lawn edging that is very good at edging, but very sharp when caught the wrong way. So do a check around your yard. Make sure if your pets are in areas where you have the lawn edging that you either put some rubber over it or like bury it in the mulch a little more so they don't just run through and rip their paw. And then muscle, ligament, tendon injuries from playing, hiking, usually not swimming, but just being active. We're an area that's very active with our dogs, which is awesome, but that does, just like us, we get in, they can get injured. So, but yeah, pretty basic stuff. I think the hardest part is, you're obviously not going to be able to prevent your pet from getting an insect bite. That's like, kind of impossible, which is why it's nice to have Benadryl on hand. Because it's never going to hurt to get the Benadryl. So yeah, you can give it to him and then call me.
Perfect. Cool. So on that note, what are some common items that people typically have in their house that are particularly poisonous to dogs?
So this is a big one, and it's honestly, I guess I kind of just thought that most people know these, but some people don't. I feel like a lot of people know certain ones and not others. Like almost everybody knows that chocolate is bad, or coffee. And most dogs aren't going to want to drink coffee, but they might if it's like a chocolatey whipped cream one from Starbucks or something. So coffee and chocolate, because they have the stimulant that's in those, which is kind of why we like them as people, can be very catastrophic to dogs. In high enough amounts, it can cause fatal arrhythmias. So The other things are grapes or raisins or any kind of that general thing. So trail mix, right? Like there's raisins in a lot of trail mix.
Right.
That can cause kidney failure. There's various components in those foods that can cause kidney failure. So if your dog eats grapes or raisins, definitely call us, get it out of them ASAP. And the weird thing about grapes and raisins is every pet has a different tolerance. So, like you could have a St. Bernard that eats 5 grapes and goes into renal failure, or you could have a Schnauzer that eats 20 and doesn't.
Mm-hmm.
So it's very weird and unpredictable, which I don't like about it. I like when things are predictable. It can be like, 5 is fine, but 10 is not. Nope, that's not the way with this.
Right.
And back to the chocolate thing, milk chocolate is the least dangerous.
Okay.
So the higher the cocoa value, in that chocolate, the more toxic it is. Okay. So that's really important to remember. You're still welcome to call us, but like, say your lab eats 2 Hershey Kisses accidentally, it's not going to be a big deal. But half of a 70% cocoa bar, that's a big deal.
Right.
Okay. So yeah. Let's see. We do see a lot of marijuana toxicity. Mostly from edibles. So, whether you're making your own or you purchased some and you just didn't put them in a high enough cabinet. Again, it's food, right? They just think it's chocolate. And at low enough doses, usually it's just supportive care for marijuana toxicity, but they can ingest enough that it will stop their heart. Their central nervous system becomes so depressed that they can't handle it. They become incontinent. They can't walk. So keep your marijuana away from your pets. Antifreeze, which is really common. I feel like garages are just not places for pets.
Yeah. Like,
do not let your dog hang out in your garage. If you do, make sure you have everything on super high shelves so that when your back is turned, bad things don't happen. Okay. Household plants. So there are many household plants that are actually non-toxic. It's just especially cats and some very curious puppies, like the one I have right now, are like, oh, eating leaves is fun. But a lot of times they can cause vomiting and diarrhea, which is not only concerning, but then you need a trip to the vet to get it to stop.
Right.
And then there are some that can be fatal, like lilies. I am a firm believer that if you own a cat, you should never have a lily in your house. Don't chance it. It's not worth it. Stems, leaves, stamens, petals, they're all bad. So, and if you like cats and have any outdoor, don't plant lilies outside either. They're beautiful. No offense to lilies, but, and then rodenticide. So this is one that I see sometimes. Mostly I feel like people with like farms or barns, it's a bigger risk. But it used to be that all rodenticides were hemorrhagic rodenticides, meaning, they have anti-clotting factors, which is what kills the rodent. But if your dog ingests it, it does the same thing to them, so they bleed out, right? Now there are some in the market that are neurotoxins, okay? And while that sounds maybe potentially not as bad, it still is bad. So the key thing is I wouldn't use rodenticides unless you absolutely have to. And if you have to, use them in a space where your pets do not have access to that space. If you are using them, or if for some reason your pet is exposed, it is extremely helpful for your veterinarian to have the package information from what rodenticide you think your pet consumed, because that is very much going to tailor our treatment. If it's a neurotoxic rodenticide and I treat your pet with vitamin K and a blood transfusion, like that's not helpful, right? So we need to know. And that kind of goes with anything your pet eats. Sometimes people will be on like a vitamin supplement or something and they drop one, right? Like on the floor and their dog scoops it up and they call and they're like, oh my gosh, my pet ate this. We're totally happy to help you figure out if that's a problem or not. And if we don't know, we'll have you call poison control. But if I know the list of ingredients, I can tell you, like, we need to do this or not.
Right.
And then, of course, personal medications. Any kind of medications or vitamins you're on, again, keep them up and away from your pets.
Right.
And if you're like me and you're klutzy, don't take your medication like while your dogs are sitting there like thinking that you have candy or something. Like, you don't need that vitamin D, that's mine. No. So.
Perfect. So then if they were to ingest something poisonous, do you recommend that dog owners try to induce vomiting?
That's a really good question that you'll probably get some various people disagreeing on. The short answer is yes, okay? But a lot depends on how long ago it was ingested, your the amount of time it takes you to get to the vet clinic. Because by far the best way to induce vomiting is with an injection of apomorphine. And so that's a drug that we have here in the hospital. You give it in the vein and the pet vomits within 2 minutes. It's amazing. It has saved so many dogs' lives. That being said, we sometimes get calls from frantic parents at work that are like, my teenagers, who doesn't drive is home with the dog. They dropped ABRT on the floor, the dog ate it, we need to get it up, what do I do, right? Well, in that case, it's gonna take quite a bit of time for that pet to get to me, so we gotta do something sooner.
Right.
And so in that case, using hydrogen peroxide is something I recommend. The danger with hydrogen peroxide is, the whole reason it works is that the O2 in there, like the H2O2 combination, causes the fizziness, right? Like if you swish it around in your mouth, you feel that fizziness. That fizziness in the stomach lining is what makes the pet vomit. It also can be very irritating to the stomach lining. So giving an injection of apomorphine is far less likely to cause gastritis or inflammation of the stomach lining than hydrogen peroxide. But again, we have to pick our battles here. It's also very important to use hydrogen peroxide that is not expired, because when it's expired, typically those bubbles aren't working anymore. And so I've had a lot of people go and be like, oh my gosh, it's expired. I'm like, okay, well, honestly, by the time you get to the store to buy peroxide for your dog, you probably could have made it to me just as quick, so just come in.
Right.
Gastric transit time is about 2 hours. Every minute counts, okay? So, if I see your pet 20 minutes after it ingested something, it's probably gonna be fine. If it's 6 hours later, we have to hospitalize. We have to treat as though the pet got that and is in their system, even if we make them vomit and some of it comes up, okay? Because some of it absorbed into the body. So dosing for hydrogen peroxide is 1 teaspoon, which is 5 mLs, per 5 pounds, not to exceed 3 tablespoons, which is 45 mLs. So again, there is a dose tap out. So if you have a St. Bernard, you're just giving 45 mLs or 3 tablespoons and that's it. Typically you wait like 10 to 15 minutes. If nothing's happened, potentially like 15 to 20 minutes after that first thing of peroxide, you can give another dose, but never more than twice. If they don't vomit within 2 doses of peroxide, they're not going to vomit on peroxide. And we do not give peroxide to cats, so don't even try. Making cats vomit is hard. It's even hard when you have drugs at your disposal, so we never give peroxide to cats. This is all dogs. Okay.
The next question is, are there any particular medical issues or injuries that are specific to Colorado? So we live in Colorado, so.
Yeah, so we talked about the laceration aspect, from sharp rocks, from ice, from lawn edging. So I feel like that's very much kind of a regional thing. We do have rattlesnakes here. The good news is we don't have them everywhere. They do tend to be more in certain spots, and they hibernate in the winter. So like they're waking up about now and they'll be awake until about the first hard frost. So trying to avoid rattlesnake bites, which is, potentially more common here, is good. For anyone that doesn't know about rattlesnakes, they do like to hang out in more arid areas where there's lots of good space for them to hide, like rocks, under logs, etc. If you know there's an area that's very populated with rattlesnakes, either don't hike there with your dog or hike very carefully. And then, so in that vein, we do have a rattlesnake vaccine. It's not for everyone. Your vet can help guide you as to whether or not your dog's a good candidate. It can give you, basically, you still have to have treatment we recommend antivenom after, even if you get bit, but it can give you a little more time to get to a vet. Because typically, once bitten by a rattlesnake, you need to be at a vet within an hour for help to be. Also, a lot of people probably don't know, rattlesnake bites, 20 to 30% of them are dry bites, so non-venomous. So just because your pet gets bit by a rattlesnake doesn't mean it's going to die. However, you don't know, so you should seek vet care. Yeah. Other than that, just things like, I feel like our climate, because we're at such high altitude, it can get very hot and sunny sometimes, and it can also get very cold sometimes. So just keeping an eye on that. If you're struggling with the temperature changes and you have on shoes and a coat, or you have on, like summer clothes and you're like constantly drinking water, but your overweight old black lab is with you, probably not the best idea for that black lab. It's too hot. Yeah. But that's pretty much it. Otherwise, I think we're pretty much like everywhere else in the country.
Cool.
Yeah.
Nice. If your dog gets bit by a rattlesnake, do you recommend just like if you're on a hike walking them out, or would you recommend getting your blanket out?
If they're small enough that you can carry them, I think carrying them's best because you do minimize blood flow, blood circulating. However, the key is speed. So if you have an 85-pound dog, I'm sorry, no matter how he-man or she-womanish you are, you're not getting that dog out of there quickly with carrying it. So just walk the dog, and then just get to the vet ASAP.
Okay.
Yeah.
Cool. Thank you. Part of learning pet first aid, obviously, CPR and just general first aid awareness. Is there somewhere online or locally that people can learn a little bit more or get certified in that?
Yeah, and I honestly had to look this up, which is a little embarrassing, but fortunately, being in this field, I've had training in these areas, and so I never was like, oh, like other people might want this. So yeah, I was like really happy when I was like researching this to find out that there are. So petemergencyeducation.com has various online courses. Redcross.org has pet CPR courses, which I totally did not know. So you can, like any other education you would pick for you or your child, you want to kind of look for credentials there. Like if it's just some rando teaching it, probably don't take that course. But if they're credentialed, then it looks like there's several options online. So that's very cool. I will say kind of a bummer about CPR. So the most successful CPR resuscitations are if it's an anesthetic induced code, because a lot of times those patients, that happens from like an abnormal reaction to anesthesia or something like that, or like maybe a cardiac issue that they were born with that just never presented itself. Patients that code at home, there's a very, very, very small chance, like less than 1% of successfully reviving them. That being said, I'm not saying don't try, but it's not great. And mostly I think, we kind of have like this view of it from people, right? Like I think a lot of, and I'm not a paramedic, so if I'm wrong on this, don't quote me on it, but I think a lot of times with people that need CPR, it's from heart attacks. And with heart attacks, it's from obstructions of the arteries that can actually be rectified with surgery. And so if we keep them alive, we can get them back. With pets, it's not that. Pets don't get arteriosclerosis like humans do. So I think a lot of times it's more of a structural thing that like we're not going to be able to fix that like fast enough for the pet. So, which is sad because, oh my gosh, it's devastating when a pet dies in front of you. So, yeah.
And then our next question, I just wanted to briefly touch on it. It's something that at All Breed we really recommend this muzzle training for all sorts of different reasons. We have a dog that eats anything off the street, so he's muzzle trained for just walks so he doesn't eat stuff. So smart. But will you just touch on it from a vet point of view and why it's important and if people should do it? Absolutely.
So a lot of people don't anticipate that their pet's going to need a muzzle until the pet needs the muzzle. So we have pets that come in sometimes at home and even with other people, not in a stressful environment, they are like the picture of friendly. But they come to somewhere where they're stressed and they might be a fear aggressor. And so when that happens, it's like fight or flight. Well, they can't go anywhere, so they're gonna snarl and growl, and then we can't give them the care they need. So I think kind of knowing your pet, and it might not be until the first time they come to the vet or that you find that out, and that's fine. So then you work on muzzle training, but for that kind of thing, it can be very helpful. If you know your pet is super laid back and really doesn't care about anything, which there are pets out there totally like that, then it's not necessary. But I do really like basket muzzles. If anyone is ever deciding they want to muzzle train their dog, and I think most dog trainers would agree, basket muzzles are the way to go. I just had a dog come in. I have two patients. There's been some inter-dog aggression in the house with just the two dogs. And, you know, but it's hard when you want to introduce those dogs back together. Like there's so much at stake. And so I said, why don't you train her on a basket muzzle, and then the two dogs can be together, and you can see where the triggers are and address those without casualty. And so she did that, and the dog did amazing with it. And she actually came in with her sister in the car, and they both got to come in and see me at the same time, which has never happened before. And they both took cheese whiz, like, so you can take treats through the muzzle, you can take peanut butter. So it's much easier than just a soft muzzle that they can't really do much on. And it protects me too. Like I'm not going to get bit through a basket muzzle unless I shove my hand in there. Which in that case, it's my fault. So yeah. So yeah, I love that. I think basket muzzle training is super awesome if you're into that.
Okay, cool. And then on that same note, any other handling, I guess, training that you recommend for dogs for coming in specifically to the vet?
Leash training. And I don't know if it's just COVID or just something happens, but I think a lot of us, especially with puppies, you get a puppy and they're so small and they're so crazy. And like you put a leash or a harness on them and they're alligator rolling and you're just like, oh my gosh, this is wild. But you have to keep at it. A lot of people around here too are blessed to have some nice big fenced in yards, which their pets love, but you cannot bank on the fact that you're never going to need to have your dog on a leash and take it somewhere. So leash train it in your yard. You know, just because they don't have to have a leash on doesn't mean you shouldn't be leash training them. So that's huge. You need to be able to pass your dog to a staff member or something and have your dog walk away from you, you know, carefully, and that's less stress on the pet. Yeah.
All right, so we'll move on, change subjects a little bit. The next question is, what do you do if your dog is choking?
So this one's really scary. If you've ever seen a dog choke, it is terrifying. So my first tip is never throw a ball smaller than your dog's mouth and throat, because I've seen some devastating consequences for that. You would never think that throwing a ball to your dog, they could catch it and it could go straight in their throat, but it has, okay? So obviously, like a tennis ball and a medium-sized dog, they can't swallow a tennis ball. Like it's not going to go into their throat. But there's a lot of these smaller rubber balls, and there's a lot of bully breeds that have very large throats. And they love these bouncy balls. You got it. The ball has to be big enough that it will not go down your dog's throat. That will prevent a lot of pain and heartache. That being said, if your dog is choking, whether it's on a ball or a stick or a piece of food, the first thing to do, if you feel safe, you need to make sure you always feel safe, okay, is to actually look in the dog's throat, and if you see something, grab for it, okay? Again, being safe. I don't want anyone to get bit doing this, but if you can see it, grab it out, okay? If you can't, you can do a variation of the Heimlich maneuver on a dog, again, depending on the size, but you know, you're gonna go right under the diaphragm, so you feel for the end of the rib cage, you go under the diaphragm and you're gonna go up and in, okay? That's basically what you're doing, is you're forcing the air in the abdomen to go up into the diaphragm and push the diaphragm up, and that's gonna create pressure that pushes things up out of the chest. So it's just a pressure gradient that you're creating, but that's what you wanna do. And then, you know, if none of those things are working, you know, obviously get to the vet ASAP. You can do some rescue breathing. Again, this is all seeing if we have a patent airway, right? Like if your dog has a ball stuck in its throat, I don't care how much you blow in there, nothing's getting in. So you can also kind of like cup your hands, it's called coupage, and slap the side of the chest a couple times. Again, you try not to break ribs, but you can kind of do that. Basically move your dog in different positions, flip it upside down, and you know, so it's kind of a combination. If anyone's ever been trained in like baby choking, it's so much like baby choking. I mean, it's the same general principle, right? Like try to get what's ever in there out, and if you can see it, grab it and get it out like a finger sweep. Yeah. Again, I hope this never happens to anyone, because it's just like, oh. But it has. And sticks too. A lot of times dogs will act like they're choking, but they actually have a stick lodged in their upper jaw. So if you're comfortable, do a full look of the oral and throat cavity. You know, like lift their upper jaw, look up in there. You know, you can find a lot of stuff just by looking.
How to transport injured dog. You touched on it a little bit. Did you want to add anything to that?
I mean, basically just the rule of thumb is keep everything as stable as possible, and don't hurt yourself trying to move the pet, because if you pick up the pet and you fall and the pet falls, like, it's not good. So if you have a large dog and you go a lot of places with your dog, it's probably a good idea just to keep a big blanket in the back of your car, and that way it's there in case you need it. The other thing you can do is if you have a front leg injury or a back leg injury in a dog and you have a towel with you, if the dog is standing there, you can adjust the towel here, and I'm a dog, so I'm over like this, and you can hold those two back parts of the towel up and kind of wheelbarrow your dog. Okay. So if it has a hip issue, we a lot of times do that for bigger dogs after orthopedic surgeries. You can kind of be a little holder for your pet's back end, and you can switch it to the front if they're having front end issues too. So towels and blankets, they have a lot of uses. Yeah.
Cool.
Absolutely. So, I recommend if you have pets, any area you live in, whether that's here or somewhere else, kind of Google all the closest ER vets, maybe put their phone number or even address just on a list, keep it in a cabinet somewhere in your house or in your wallet or whatever, and that way you have them at your disposal. Around here, the 2 24-hour ones that are closest are going to be Powers and then AERC. And so AERC is on North Nevada and Powers is on Powers. And they both have specialists as well. There's also Parker, up in Parker. There's ER and Castle Rock. But again, if you live like near Fountain, going to Castle Rock is a haul. However, if it's not super urgent, but urgent enough, if say you get to Powers or ERC and they're like, yeah, we have a 12-hour wait, you can start calling other places and see what they have. Tri-Lakes ER up in Monument is only open. They're not open 24/7, but they are open some hours that your regular vet is not. So that's a place to call. So yeah, just kind of Google it and see what's open. I think Uinta also has hours, and I think at some point they might be going 24 hours too, which would be great because there's plenty of need for emergency around here. So yeah.
Cool. With Colorado, the weather being so extreme, it gets super cold and super hot. So can we just touch a little bit on heat stroke and frostbite?
So the heat stroke thing, I kind of mentioned a little bit with the obese black lab situation. So I was hiking with my family in Garden of the Gods last summer, and it was hot. We were dressed for the weather and we were still hot. And there was this poor dog in front of me on the trail, and I was afraid that I was gonna have to perform vet care right there on the trail because he was so hot and so out of shape, and the sun and having black fur. So just again, use your common sense. I love taking my dogs everywhere too, but I have black dogs. Right. And so if it's in the summer when it gets hot and the sun's at its highest point, I'm like, okay, we're walking in the woods, or we're walking in the morning or the evening. You got to be smart about it. If something happens, and also that's the other thing too that people don't realize, dogs are not like people when it comes to heat and cold. Right. If I'm hot, I'm going to be complaining, right? I'm hot, it's so hot, I need some water, I need some AC, whatever. Dogs just want to have fun. Right. They really do. They will run until they pass out. So they do not, you have to be their voice for that because they're not that smart. They really just want to run. So if you notice your dog's really struggling or laying down, don't throw the ball again. Let them lay down for a little bit, always have water. If you do think your dog has heat stroke, get a hose with cold water, hose them off. While you're transporting them to the vet, put some ice packs on them, things like that. You can die from heat stroke 100%. Okay. But if you kind of use your brain first, hopefully we can prevent the heat stroke from even happening. Yes. And frostbite. So that's another thing, limit exposure. Okay. Strangely, their feet are more capable than you think. So, I would never hike in the snow in bare feet. I'd have my nice cozy boots on. But if you've got a dog with long hair or even kind of thicker husky hair, they can handle it. It's ice that's more the problem. And of course, time, right? you can take your dog on a walk for 30 minutes when it's 25 degrees outside, but probably not a 5-hour walk. Right. There is a product called Musher's Secret that a lot of dogs that do the Iditarod and things like that use, and that can be very helpful. It's more of like a petroleum-based product that you slather on their paws, and the same thing can be used on the ear pinnae of dogs with really tall ears. It's all about surface area, right? So if you've got like a German Shepherd, their ears are going to be big and tall, so they're going to freeze at the tips first. So you can do that too. Yeah.
Cool.
Yeah, I think that's pretty much it about that. Yeah.
I mean, do you have any items that you would add to it? Like, say if you go on a hike and it's 60 degrees out, but being Colorado, all of a sudden gets 90 degrees. Do you have any like an umbrella for shade or anything like that?
Yeah. I mean, I think the biggest thing is just watching your dog's cues. If you know your dog, you've got a dog that's usually very fit and ready to go and always like first on the trail in front of you, and they're kind of dragging, take a break. It's amazing how much just taking a break under a tree can just, and letting them have some fresh water, like just take your time and then, go back down. I think the biggest thing is when we get into some of these places, like for instance, Garden of the Gods, or like some areas in Pueblo where it really just gets so hot so quickly, you got to have water and you got to be able to find shade. And the color of your dog really does matter. A white dog is not going to get as hot as a black dog, even if they both have a thick hair coat. It's just, that's just the way that sun works.
Yeah.
So, yeah, I did mention overdosing on human medications, but you're absolutely right. Overdosing on tasty canine or feline medications also happens. So, for those of you that don't know, Rimadyl is the brand name of the doggy ibuprofen type stuff, and it is, I mean, I haven't tasted it, but if I was a dog, it smells pretty good. It's a flavor tab. So there are multiple different kinds of flavor tabs now. Clavamox has some of those. And so any of those products, even if they are for your pet, you do want to keep them out of your pet's reach, because we do routinely treat dogs for Rimadyl overdoses. And, a small amount of Rimadyl at the correct dose is life-changing for your pet. Eating a bottle will kill their kidneys and liver. So, and obviously they need attention right away to get them to vomit or whatever. So, keep those, out of. And then I'll touch on small children and dogs and ingestion of things too, because I have small children, and fortunately they're a little older now, but it was really a challenge during the even younger years. But, raisins are a really big favorite food of little kids. And it doesn't take much for the dog to just be like, and just like take it out of their hand. Children can be kind of messy when they're eating. We usually put the dogs up and in their crates when we're eating dinner, because it just makes life easier. And even the eating, having your own medication, or like just making sure, nobody's accidentally giving the dog things. Keep Legos and other small things up out of the way. Nerf darts are huge. We do so many surgeries for ingestion of Nerf darts that get stuck in the small intestine. So keep your Nerf darts up and away from your pets. It's weird. I don't know why they want to eat them, but they love them. Some dogs will they gravitate toward them. I don't know why.